Hello there, my name is Bradley Bearden, and for my project I chose Bacillus anthracis. So the first thing we're going to talk about is the toxin produced by Bacillus anthracis. It's comprised of 3 different proteins, a protective antigen which bonds to host cell receptor sites, and allows a lethal factor and an edema factor to enter the cell. When the lethal factor enters the cell, it acts like an enzyme and cleaves mitogen-activated protein kinases, which are important in triggering many cellular responses. This eventually leads to cell death and septic shock. The edema factor enters the cell and also acts like an enzyme, producing higher levels of cyclic AMP. This causes the cell to swell and eventually lyse. That information was from the NIH and University of Chicago Medical Center. Normally, Bacillus anthracis resides in calcium-rich soil that is alkaline. It is transported by animals eating the spores and then dying and decomposing, where all the vegetation around that animal is now, it's got the spores all over them. It can infect in 3 different ways: cutaneously through a cut on the skin, it can be ingested and infect the GI tract, and it can be inhaled to infect the lungs. A couple virulence factors are the anthrax toxin, which was mentioned before, a poly-Y-glutamic acid capsule that allows it to dodge phagocytosis and the rest of the immune response, and anthralysin O, which is a cytolysin. It is a toxin that forms pores in the cell membrane, and that information was from the NIH. Bacillus anthracis is known to cause anthrax, which is an acute and life-threatening condition. It can infect through various routes, like we just talked about. In cutaneous infections, the symptom is a small bump that then transforms into a black necrotic scab that will continue growing if left untreated. The area around the scab will also swell, and the lymph nodes for that section of the body will also swell. Some symptoms of inhalation include fever, chills, fatigue, coughing, shortness of breath, chest pain, nausea, vomiting, and diarrhea. This is actually the deadliest form of infection, and this would be the respiratory infection. Some symptoms for the ingestion and infection of the GI tract include fever, nausea, vomiting, abdominal pain, bloody diarrhea, mouth sores, and swelling of the neck and throat. So your treatment options when you're dealing with anthrax is antibiotics like ciprofloxacin and doxycycline. If these can't be used, then penicillin will be used alongside an antitoxin to combat the anthrax toxin. In cutaneous infections, they give you antibiotics for 7 to 10 days and then just kind of monitor you. In inhalation, it requires immediate and aggressive medical treatment, including antibiotics, the antitoxin, oxygen therapy, fluid management, and even a ventilator in some cases. With ingestion, they would just give you antibiotics like they would with the cutaneous infection. An anthrax vaccine also exists for higher risk individuals like livestock workers. Not so fun fact, this is actually the reason I chose anthrax. In 2001, 22 letters containing anthrax were mailed in an attempted assassination of some U.S. senators and other powerful people. While no senators ended up dying, 5 people were actually killed. 2 were postal workers, 1 was a hospital worker, 1 was a photo editor, and another was a private citizen. So the FBI actually opened an investigation after the attacks and concluded they were perpetrated by Dr. Bruce Ivins, a microbiologist working at the U.S. Army Medical Institute of Infectious Diseases, but he committed suicide before he could be charged with any crime. So anyway, that has been my project. I'm sorry for going a little bit over. Let me just make sure I cited my sources correctly. Virulence factors was the NIH. Normal residence was the Cleveland Clinic. Pathogenicity was the CDC. Treatment options was the Mayo Clinic. And and known diseases section was the Mayo Clinic. Oh, and then toxins was NIH and the University of Chicago Medical School. Thank you.